Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crown glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, hair problem was associated with middle age when you used to lose hair or have thinning of hair and bald patch hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided and can be fixed by managing to modify our faulty lifestyle. Today, we have with us Dr. Richa Thakur. She is Associate Professor at NSMCH Bihta and consultant at Ortho and Skin Clinic, Billay Road, Patna. She is an ex-assistant professor at PMCH Patna, ex-senior resident at IGIMS Patna, and has been practicing medicine for over 11 years now, and is known for her exceptional medical expertise in trichology, cosmetology, and clinical dermatology. Dr. Richa Thakur has dedicated her career in diagnosing and treating a wide variety of skin and hair conditions while providing personalized health care to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Richa Thakur is aware of the need for the patient awareness and education about hair care and spends a lot of time in giving talks at various platforms across the country. Thank you, Dr. Richa Thakur, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show. Dr. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So, Doctor, we are going to discuss the role of vitamins and mineral in the management of hair loss. So, when we are talking about hair care, the first and foremost question which comes up is the hair loss, which is now faced by all of us, irrespective of age and gender. So, what is normal and when to be concerned for?
Hair loss is a very big term. In hair loss, usually we call telogen effluvium in our medical terms. And coming to the point that every person has a fixed strand number of hairs on their scalp, and every person loses a fixed amount of hair daily. That is like 60 to 70 strands are shed every day. That is normal. So if a person loses more than 70 hairs per day, more than 70 to 80 hair loss is considered as telogen effluvium, that is hair fall.
So more than
various causes of hair fall.
Yeah, so Doctor, so the next question which come up to our mind is the causes. So what are the general causes of hair loss? Like, why do it happen?
Like most important and foremost cause is stress. Like in this era of pollution and everyone has a very busy schedule. So stress is very common these days. So stress aggravates hair fall. Season also has a role, like rainy season that aggravates hair fall. So this is the season of hair fall. Many diseases like typhoid, malaria, even COVID that led to hair fall. So any infectious condition that leads to hair fall after a certain period of time, mostly like any disease condition. Even after pregnancy, like in lactation, after 5th month of pregnancy, all the patients, they come to us for hair fall. So after delivery, there's a period of hair loss that is called as, that we commonly see for hair loss. These are the most important causes of hair loss. Even anemia. If most of the female patients, they are anemic, they have hemoglobin level less than 11. So we see cases with anemia. Thyroid also leads to hair loss. Even diabetic patients, they are more prone for hair loss. And some conditions like vitamin D deficiency, that also leads to hair loss.
Okay, so Doctor, like you said, stress. So Also there are like nowadays we are all having a bad lifestyle, like working late hours, not sleeping and eating not right. So can a person lifestyle play a role in hair loss?
Lifestyle definitely can play a role in hair loss. If we see a patient of chronic hair loss, I advise all my patients to go for yoga if they have stress full of life. So yoga definitely has a role that can reduce your stress and that can reduce your hair fall.
Okay, so doctor, like you have enlightened us about the causes and hair loss. So what are like what are the medical treatments option available for hair loss? Is there some surgical or non-surgical or like topical or just oral also? Can we just eat and manage our hair loss?
Uh, any treatment that depends on the cause. If the cause is like deficiency of hemoglobin or deficiency of vitamin D or any micronutrients, then in that case we have to correct the deficiency. If there's for the medical treatment as well as surgical treatment and oral treatment is also available. For FDA approval, only topical minoxidil is approved. That is approved for hair loss. Like topical treatment, we can go for minoxidil. That can be of percentage 5 to 10. Then other topical, like there are various ingredients like procapil and all that also reduces hair loss. And oral treatment like biotin, other micronutrients, vitamins, and they also leads to hair prevention of and decreases chances of hair loss. Whereas in some condition like androgenetic alopecia, we have to go for some finasteride and oral minoxidil also for androgenetic alopecia.
Okay, and when nothing works,
Yeah, surgical hair transplant is the final treatment. That is surgical.
Okay, so surgical is also available. Okay, so doctor, like when we are talking about so many treatment nowadays, a word called nutraceutical is coming up into a lot of focus. So what is nutraceutical and what is the role of nutraceutical in hair health?
Nutraceuticals are just the vitamins which our hair needs. Like these are the products like biotin and other micronutrients like selenium, magnesium that is needed for a better hair growth. So these definitely have a very good effect in prevention and decreases hair loss.
Okay, so doctor, can you enlighten us like which are some of the herbal or like plant extract or constituent used to manage the hair loss or alopecia?
There's a condition like alopecia areata, which is an autoimmune disease. In this, we can see patches of hair loss. And in alopecia areata, many of the time, garlic, onion, these are our patients' verdict. We usually they get very good results because these are nothing just the irritant. Onion, onion, and garlic, fenugreek, that leads to irritation of the scalp and that increases blood supply of the scalp and leads to development of new hair in alopecia areata. So these are the plant extracts which is commonly used in alopecia areata.
Okay.
Aloe vera also has a role.
Okay, so doctor, is there like a plant extract like also like grape seed and omega fatty acid, 3 fatty acid? Do they promote hair growth?
Yes, grape seed extract and omega-3 fatty acid that increases hair growth. And so definitely they have very good results in hair loss cases.
Okay, so doctor, like you said, nutrients are really important for healthy hair. So like there are so many nutrients, micronutrients, macronutrients. So what is micronutrients and what is the role of micronutrients in hair health?
Micronutrients are compounds which are needed in very less quantity for our hair growth. These are substances like magnesium, selenium, which should be in a very minimum amount that is needed for our growth. And these definitely has role in hair growth. So micronutrients as well as macronutrients, they both add to a better hair growth, and that fastens the growth of hair follicles.
Okay. So, doctor, like, can we take these nutrients like not using a prescription or something? It is, or is it required to take these nutrients as per gender RDA requirement?
It's always better to take a prescription, because nowadays every patient, they are doing Google and they are taking many supplements on their own, and finally they land to us because they don't get any benefit. So because we have to know the cause of hair fall, unless we know the cause, nothing can be treated. So it's always better to take any subscription after your doctor's prescription.
So, is it like there are like nutrients also need to be taken as per gender RDA requirement? Like,
Some of the nutrients that should be taken according to recommended daily allowance, because in males that requirement is definitely high, whereas in females it is always low. So your doctor will prescribe you the nutrients according to your gender requirement and your daily intake that is needed for you after seeing your blood investigations.
So, doctor, like after talking about hair loss and its treatment, another most common problem is dandruff. So, does dandruff really cause hair fall?
Yes, dandruff is nothing but growth of fungus. So dandruff leads to hair fall. Many of the time we get patients who come to us because of dandruff leading to hair fall. So unless we treat that dandruff, hair fall is not going to stop. So we have to treat the cause of hair fall. Then only hair fall will stop.
Okay, so to stop the hair fall, we also need to take care of our dandruff.
Yes.
Okay, so like doctor, you have earlier said that stress do play a role in hair health. So can you please enlighten us little more about the impact of stress on our hair health?
Stress definitely many most important causes, like if the patient is a student, he's having exam after every 3 months. So he's in regular stress, and regular stress is there in his life. So he's going to face hair fall. So I ask all my patients, if they are a student, like till when you are going to have your exam, till that time you'll have your hair fall. And you have to convince your patient, like once the stress is gone, so either you can deal with your stress by having a better lifestyle, by taking better more amount of protein in your diet, by following a healthy diet, because most of the students, when they are in hostel, they don't take required protein level in their diet, because whatever they get in their mess or hostel, they will take that also leads to hair fall. And stress is also there. So unless the stress is reduced, hair fall is going to be there. So yoga, meditation, that has very good result in all these chronic hair loss patients.
Okay, so managing stress is important. Okay, so doctor, like most of the people are doing work from home, so मम्मी लोग कहती है कि ऑयल लगा लो, मसाज कर लो, स्ट्रेस भी कम हो जाएगा. ऑयल लगाने से बाल भी लंबे होते हैं, बाल भी शाइनिंग होते हैं. ऐसे मतलब स्कल पे ऐसे बहुत सारा लगा लो. So is it like oiling hair is a boon or a ban?
Oiling has some benefits, like if your hair is very dull and brittle, oiling definitely will add to the lusterness, and that will give a shiny look. But if you keep on applying frequently oil, that leads to growth of fungus, that leads to dandruff, and that again will lead to hair fall. So oiling should be practiced, but it should be done half an hour before hair bath. Like if you are going to do a shampoo for your hairs, you should apply only 30 minutes before your head baths. Otherwise, it should not be leave-on procedure. It should never be a leave-on procedure. Oiling should, that will aggravate your dandruff.
Okay. So like oil से बाल लंबे नहीं होते, so shine.
ऑयल से लंबे होने का कोई रोल नहीं है.
Okay. So doctor, can you give us some important tips for healthy hair?
Yeah. For healthy hair, you should follow up better sleeping hours. Like 8 to 10 hours of sleep is a must for a better and healthy hair. Protein requirement should be there in your diet. If you are non-vegetarian, you should take boiled egg in your diet regularly. That will lead to a better hair, like dal, protein. Other protein requirements also can be added, and stress-free. And hair should be cut every third month for a better growth, and then only you'll have better growth. You should cut your hairs from down every third month.
Okay, this discussion was very informative, and I'm sure our viewer would be benefited by it. So, Doctor, can we take some live questions from our audience?
Sure, sure.
Okay, the first question from our audience is, Doctor, I am already facing a hair loss, and to prevent it, what precautionary measures should I take? And can you please suggest some type of drugs which can be taken to manage hair loss?
Drugs should, it's difficult to suggest right now. Like regular measures, like you should do your blood investigation first, you should take protein diet, stress-free environment should be there, and oiling should be lessened.
Okay.
And protein diet should be added in your diet.
Okay, so the good diet is actually important for managing hair loss. Another question from our viewer is, Doctor, I'm having vitamin D deficiency, and my doctor said maybe because of that I'm facing hair loss. So can you please let me know what is the role of vitamin D in hair loss?
Yes, vitamin D has very important role in hair loss. Most of the patients, if they have vitamin D level below 10, then they will have severe hair loss. And depending on the level of vitamin D deficiency, hair loss is there. And unless the vitamin D it's corrected, you'll have hair loss. So you have to correct your vitamin D. That is most important for any hair loss patient. You have to take vitamin D supplement. And exposure to sunlight is also must. But since nowadays no one is exposing ourselves to sunlight, so that is a most important reason. Like 80% of the patients, they are deficient in vitamin D.
So, doctor, like when we are deficient to some kind of vitamin, so can these medicines and measures actually fulfill the requirement, or we need to take these supplements for like forever?
No, it has never to be taken forever. Like how much it is lower. Like usually it gets corrected in 1 to 2 months. So after that, there's no need to take. Once it is corrected, you should take weekly if you are not exposing yourself to vitamin D. So it's always advised, and that is every female above 40, 45, they should take vitamin D supplements to prevent other causes like vitamin D deficiency. So even in children, that is given, that is a normal dose that should be given weekly for better development of bones. And
okay, another question from our viewer is, ma'am, हम कैसे differentiate करें between normal hair loss and a more serious underlying problem?
नॉर्मल हेयर लॉस लाइक अगर रेनी सीजन में आपका बाल गिर रहा है, पहले 60 गिरता था, अभी 65 गिर रहा है, तो दैट इज जस्ट बिकॉज ऑफ द चेंज इन वेदर. रेनी सीजन में बिकॉज ऑफ द अदर कॉजेस, ह्यूमिडिटी के कारण हेयर फॉल ज्यादा होता है, दैट इज अ फैक्ट. अगर वही किसी का बाल मोर देन 100 स्ट्रैंड से इतना ज्यादा गिर रहा है कि वी गेट पेशेंट्स, दे कलेक्ट देयर हेयर्स इन प्लास्टिक बैग्स, तो डेफिनेटली दैट इज अ कंसर्न. एंड हाँ, अगर कहीं एक पैचेस दिख रहा है आपको, बहुत बार पेशेंट्स पैचेस देखते हैं स्कैल्प में, कोई एक एरिया खाली हो रहा है, तो दैट इज डेफिनेटली अ कंसर्न बिकॉज दैट इज अ डिजीज एंड दैट हैज टू बी टेकन केयर इन प्रायर. It should never be avoided.
Okay, this is very interesting, doctor. Another question from our viewers, doctor, I'm in late 40s and before I never faced hair loss, but now with aging, I'm shading hair and I think I'll be bald soon. So is it because of age or is it because of some deficiency?
Maybe it will be because of deficiency. Age has no reason for hair fall. One important reason is nowadays all of the patients they are doing many hair treatments like spa, what all like straightening, coloring, and these things like they break your bonds. So all this treatment, keratin treatment, and all smoothening, and these leads to hair loss. So many of the time we see patients, they have done any treatment 3 months back and they'll have severe hair loss because that has to be there. Your natural bond is broken. So hair loss has also increased because of these treatments.
Okay. Okay, another question from our viewers. Doctor, we saw so many ads on TV that so many shampoo with minerals, vitamin, which help to hair health. Is it true that these shampoos can help to grow the hair again if I don't have hair?
Shampoos, they don't have much role. Whatever you are eating, there's some deficiency in your body that leads to hair loss. So shampoo, they just clean your hair. So any shampoo which should be mild, that should not be very harsh. Other
Mhm.
than that, shampoo has not much role in hair loss.
Okay, and not even in hair growth?
No, definitely no. A big no.
Okay, because there are some shampoos which okay. So this is an interesting question, doctor. This lady is asking, is there any difference in hair care for different type of hair? Because my daughter have curly hair and I have a straight hair, and my husband has mix of both straight and curly hair, but we all three face hair problem. So am I doing something wrong?
Definitely, there's some differences. Like in curly hair, most of them they'll have very dry scalp. Many of the times, the patients they come to us like the scalp is very dry because of the curly hairs. So, and they keep on applying lots of oil to remove the curls. That definitely has no roles. So nowadays, hair moisturizers are available that should be applied for dry scalp. So when you consult your doctor, they'll see your hair type and they'll recommend any medicine depending on your problem.
Okay, interesting, doctor. Another very interesting question from our viewer. डॉक्टर मुझे किसी ने बोला लेमन जूस से डैंड्रफ भी चला जाता है और होम रेमेडीज बहुत ज्यादा इफेक्टिव होती हैं प्रोफेशनल ट्रीटमेंट से फॉर हेयर फॉल. तो क्या मैं ये होम रेमेडीज जैसे लेमन जूस हुआ वो लगा लूं अपने बालों में?
Many of our patients they have given the review like lemon and sour curd that has very good results. So there's no harm in applying these home remedies. I tell my patients if you are benefited with that, you can keep on applying. That has no side effect because that is a natural thing.
Okay. Interesting. Doctor, one more interesting question. Doctor, you said keratin and chemical treatment should be avoided, but I have already done this and I'm facing a very severe hair problem. So is it possible to reverse hair damage due to the heat treatment I have done?
No, no. You have to face it for 9 months. After that, your hair will be better.
Okay. So 9 months like...
So that is just a learning for you. I tell all my patients, since you have seen this, if you come to me before, if I tell you not to do it, you'll feel that I wanted to do the treatment, I'll look better. But once you see the results, after that, you're not going to do it again for your hairs.
Okay. Another interesting question is, doctor, to visit some marriage, I wanted to lose a weight, so I switched myself to a crash diet, and now after that diet, I am started facing hair fall. So is it because of that crash diet which I did?
Yes, definitely. Any crash diet, because once we are eating less, we are deficient in many macro as well as micronutrient, which should be there in our diet. So definitely hair fall is severe in those cases. So you should take some multivitamin or biotin supplements with your crash course diet.
Mhm. Okay, another question from a male patient is iron use in men patient is very important uh, or not in hair loss.
Iron definitely has a role in hair loss. If
Yeah.
the person is iron deficient, like if the hemoglobin is less, then only iron has a role. Otherwise, it's not advisable to recommend iron in any patients. And
Okay.
male, usually we see very less cases are iron deficient. Most of the times, females are iron deficient.
Okay. Another very interesting question is it true, doctor, that coloring your hair will damage it? Do the quality of hair color matters?
Coloring definitely damages the hair, but in some condition you have to do it. And yes, brand matters a lot. Any PPD free dye that damages your hair less.
Okay. And the question is, doctor, my mother, I use a small mouth hairbrush, but my mother told me to use a wide mouth hairbrush. So, does this type of hairbrush or comb will affect the hair health?
If you are using a wide mouth in wet hair, that is good for your hair because your hair fall will be less.
Mhm.
Otherwise, not much role.
Okay. Another question is, doctor, can using natural or organic hair product, which are nowadays in the market, can make hair difference in hair loss?
No,
Okay, so it's better to visit the doctor and find out the root cause. Another very interesting question is, doctor, my daughter is 12 years old and she's having gray hair. So why she's having gray hair and can it be reversed?
gray hairs, definitely that is canitis. That is a disease. Like
Mm.
in those patients, we have, if it is heredity, then you have, there are some medications are available, some topical medications and some oral medication we give that has to be continued for a longer time, 9 to 11 months. That
Mhm.
will not reverse, but it will lessen. It will, after that, you'll not see more number of white hairs, like it will halt your graying of hairs. And that is also very important role because nowadays we are getting patients of 6 to 7 years with
Mhm.
white strands. So
Mhm.
definitely stress and environmental factor again has a role. Even many of the times thyroid has a role in graying of hairs.
Okay. इंटरेस्टिंग डॉक्टर डॉक्टर क्या ऐसा कोई विटामिन और मिनरल है जिसका जो बॉडी में ज्यादा होने से भी हेयर लॉस हो सकता है?
नहीं.
Yeah. Another question is, Doctor, I recently delivered a baby, and during my delivery time, I faced gestational diabetes. So, is it because of the gestational diabetes I'm facing hair loss, or is it because of some deficiency? Should I visit to the doctor?
No, after delivery, after 5 months of delivery, hair loss is a physiological condition. So if you visit your doctor will give you some serums which is safer in lactation period, and that will definitely decreases your hair loss. It's not because of gestational diabetes. That is
Okay.
a physiological condition.
Okay, it is because of the delivery. Every
Yeah.
woman gets.
Pregnancy, that is because of pregnancy.
Mm.
Actually, in pregnancy time, hair loss is stopped.
Mhm.
So after delivery, all those stopped hair, they keep on falling. So after 4 to 5 months, there's severe hair fall.
Mhm. Okay. Another question is, how much uh, how much does biotin require in hair loss cases? Mm.
Only biotin has not much role. Many of the time we get patients, they are taking biotin this much, but still hair loss is not. Biotin itself is not the only reason for your hair loss. In fact, there are multiple reasons that has to be screened and that has to be taken care. Then only your hair loss will stop. Biotin, only taking biotin in a fixed doses, that's not going to stop your hair loss.
Okay. Okay, another interesting question. I think everyone wants to know. Doctor, recently I am facing hair loss and I think I should visit the doctor. So can you please help me to identify a step-by-step manner that why to find out the reason for my hair fall?
If you're
What
facing right now, like it was not there in June and May, so maybe it is because of the season. And still, if you are facing, then I'll do some full tests and all, and after that, I'll do your blood investigation to know the causes of your hair fall.
Okay, so better to visit the doctor.
Better to visit the doctor.
Doctor, there is a treatment called PRP treatment. Someone told me that मेरे को thyroid है तो मेरा hair loss PRP से चला जाएगा. तो ये सच है क्या?
Thyroid में hair loss होता है. If your thyroid is controlled, then it will be better with some topical and some oral treatment. PRP definitely हम लोग करते हैं. Male pattern androgenetic alopecia में करते हैं. That has very good results. Like along with topical treatment, PRP has very good result, and in that we do microneedling also. After that we inject. So PRP definitely has very good results in male pattern androgenetic alopecia and in some cases of chronic hair loss in females also. So your doctor will advise you accordingly.
Okay. Okay, so PRP do not have any side effects like?
No. There's no side effect. It's just an outdoor procedure. And immediately after the procedure, there's no side effect.
Okay. Another question is, doctor, I am 30 years old and recently I'm diagnosed with PCOS. And my friend told me that because of PCOS, I am having this hair fall. So is it because of PCOS?
Yes, many of the time because of PCOS, there's lots of stress and there's weight gain. All these factors, many of the time even there's abnormality in periods and all. These factors leads to hair loss. PCOS, we get patients with PCOS and hair loss. That is commonly nowadays.
So the woman with PCOS, can they?
All PCOS, the women, they never get hair loss.
Okay.
If PCOS along with severe periods abnormality, stress, these factors leads to. So PCOS itself is not a single factor for hair fall. Okay. And all PCOS, they don't have hair fall.
Okay.
Most of the time PCOS, they have hirsutism. They'll have more hairs.
Okay. Another interesting question is, doctor, I got COVID in 2021, and after the COVID, I got recovered. My body is fine, but my hair loss is there, and I don't know why I'm facing this hair loss. Is it because of COVID?
After COVID, hair fall was commonly seen up to 3 to 6 months. So if you are facing hair loss till now, you should definitely visit your doctor to rule out all other causes, because now COVID is almost gone. So you should be screened by your doctor.
That means she's she's not visiting to the doctor. She should, instead of waiting for more time to get all the hair. Yeah. So, doctor, another interesting question is, doctor, I'm at a menopausal age, and before I never have the hair loss. So is there any relationship between hair loss and menopause?
No, not.
Okay. So it just like even like people say that take these
like in menopausal age there'll be stress, and most of the patients, they are on hormone replacement therapies and all, and stress definitely, if the patient is in stress, then hair fall will be there.
Okay. This is very interesting question. Everyone wants to know. Doctor, there are so many medicines available on Instagram, Facebook. People say, take this, your hair will come, and I have androgenic alopecia. So is it true that if I take this Instagram medicine and my hair will come back?
I have very good answer for that. I tell everyone who's making Instagram videos, they have not wasted any time in doing all the studies about hair, nail, and skin. And all those who have wasted their minimum 13 years in studying hair, nail, and skin, they hardly make any post. So don't follow these posts. They are not going to help you in any way. That will just waste your money. And finally, you'll have to visit your doctor if you want to take a proper, and if you want to correct the proper disease. So you have to visit your doctor.
Okay. So better to self-prescribe, it's better to visit the doctor. Another question is, ma'am, can a change in diet cause hair loss due to nutrients?
Yes,
What to
diet,
do?
the plants, any keto crash diet, they all lead to hair loss because they are deficient in macro as well as micronutrients. So hair fall will be more after any diet.
Okay. Another question is, doctor, I have a high blood pressure problem and I take medication for this. And recently I have been diagnosed with androgenic alopecia. So is it because of my high blood pressure or is it because of what?
Androgenetic alopecia is a completely different entity. That is a disease. In that, you'll have central and recession of your hairs. That has no role with your BP medications and all. That happens because of hormonal imbalance, and that has no role because of your hypertension and all.
Okay. The same audience, the viewer is asking that doctor, for androgenic alopecia, do I need to take medication for whole life? These, like, I have got many vitamins and minerals, so do I need to take for whole life, or is it for
androgenetic alopecia, topical medication almost you have to apply whole life. Or if it is severe type, you can go for hair transplant. Then you can halt your application of medication and intake of medication. Hair transplant is the final. But if you are not going for hair transplant, topical, you have to continue for a very longer time, almost your lifetime.
Okay. So in some topical cases, we need to take for whole life. Another interesting question is, doctor, the same person is asking for the daughter who had a graying hair. So he's asking, can you please suggest me the best treatment for premature graying of hair?
For premature graying, most important reason you have to investigate, like thyroid, hemoglobin, all these parameters have to be checked. And if everything is normal, then there are some topical preparation which can be advised after seeing the patient. Because if there's only 1 or 2 strands, then there's no need to apply any medication. If there are more number of strands of white hairs, then definitely depending on the severity, like medication will be there.
Okay. Another question is, डॉक्टर, पहले मैं हीना मेहंदी लगाती थी बालों को कलर करने के लिए. अब मैं कलर करवाना चाहती हूँ, लेकिन मुझे किसी ने कहा अगर आप हीना लगाते हो तो आप कलर नहीं करा सकते क्योंकि बाल खराब हो जाते. तो क्या ये सच है?
नहीं, हीना लगाते हो, हीना अगर आप कोई भी पैक्ड लगाते हो तो उसमें भी उतना ही आर्टिफिशियल इंग्रेडिएंट्स एडेड है. कलर भी कर सकते हो. हिना अगर आप बस नेचुरल हिना लगा रहे हो पेड़ के पत्ते का, दैट इज ओनली प्योरेस्ट फॉर्म. उसके अलावा जितने भी पैक्ड हिना है तो दैट हैज एडिटिव्स एंड मेनी इंग्रेडिएंट्स एडेड टू इट. सो यू कैन कलर योर हेयर.
Another question is, Doctor, you said aloe vera is good for hair health. So can you please let me know what are the benefits of using aloe vera for hair loss?
If your hair is very dry, brittle, lusterless, then you can apply aloe vera will lead to a shiny hair. So dry, damaged hair, you can apply aloe vera. That will give shininess to your hairs.
Okay, doctor. So we are running out of the time, so I'll just take the last question from our viewer. Doctor, I'm facing a dry scalp and I have lot of itchiness. So, and I'm also using an anti-dandruff shampoo, but it's not going on. So can you please suggest me the treatment for dry scalp?
Anti-dandruff shampoos itself add to dryness of the scalp. So there are many scalp moisturizers available as a medicine. That will I think I should not name a product on this channel. But any moisturizer which can be recommended by your dermatologist, that will prevent your dryness of scalp.
The same person is asking, ma'am, Patna में आपका clinic किधर है?
Daily Road में पारस हॉस्पिटल के पास है.
Okay. Okay, maybe he will visit. Okay, thank you, doctor. So, doctor, would you like to give us a take-home message or any other suggestion to our viewers today?
Your take-home message is most important. Sleep proper, eat proper, and stay healthy. And a stress-free life. That will be better for your healthy hair, skin, everything.
Thank you so much, doctor. Thank you for sharing so much of information and all your expertise with us today and answering all the questions of our viewers. And I'm sure our viewers have found the session very helpful. Thank you, doctor. It was a delight to have you. And thank you so much for your valuable time.
Thank you. Thank you.
Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today. Thank you.